viewers of this Cancer Care Talk Show. I am Kamal Narayan, CEO of ISW Council, India's premier institution for health awareness, advocacy, and behavior change. The Cancer Care Talk Show has proved to be a crucial part of sharing evidence based information among the patients and their families. Last year, at a time when institutional care was not accessible due to pandemic. And today, with the pandemic forcing many changes in our daily life, we continue to bring these discussions to you for a better understanding of the disease. Preventing cancer and detecting it early plays a crucial role in the treatment regimen. Given that a large share of cancer cases come to doctors at a later stage, cure becomes challenging and mortality rate goes up. A look at the cancer scenario in India will tell you why the discussion today is needed. India sees over a million cases of cancer every year, and which is expected to grow by around 15%. With the World Cancer Day around the corner, it is only imperative that we attempt to make people aware of the importance of cancer prevention, screening, and detection. Today we have with us one of the finest names in the cancer care in our country, Dr. Ashok Kumar Vaid. Dr. Vaid is the chairman of Medical and Hemato-Oncology at Cancer Institute of Medanta Hospital in Gurgaon. He has been honored with the prestigious Padma Shri Award, and he has the unique distinction of carrying out the first 25 bone marrow transplants in any private sector hospital in North India. Dr. Vaid has also conducted over 40 international and national studies in clinical research and is known for organizing numerous seminars, workshops, and conferences related to cancer care and the new advancement of the therapies. Dr. Vaid is also an expert in managing patients of brain cancer, blood cancer, bone cancer, and stomach cancer, colon cancer, rectal cancer, thyroid cancer, and almost every type of cancer which we may be knowing. So let me welcome Dr. Vaid on this special show of cancer care during the pandemic or during COVID-19. So welcome Dr. Vaid to this show.
Thank you, Kamalji. It's an honor and a privilege indeed to be a part of the proceedings. And with IHW, it is indeed a greater pleasure to be involved in discussions centered around early detection, prevention, because that is the key. As you said in your opening remarks that our patients are coming late, cancer burden is very high. Therefore, talking about preventive measures becomes very, very important. Dhanyavad. Thank you so much.
Thank you so much, sir. We are, really honored, to have you on this special show. Having such a special and somebody who has been contributing to the cancer care immensely in our country, it is a great pleasure for us as well. However, before I begin our conversation today, I would request our online viewers to keep sending their questions on the comment box, and we will try to answer most of them in the next 30 minutes. Also, like, comment, and share this special program with your friends, families, because this may help many of them or may help those who may require this information. So let's begin, Dr. Vaid. I would be asking, initially the very, basic questions to understand, what bone marrow transplant is all about and why it is needed. Before that, the majority of the cancer cases in India emerge at a later stage, as I mentioned, and you have also kind of highlighted that, pushing the number of deaths to a very high level. Why do you think that despite rising numbers every year, we still lag in the early detection and prevention of cancer? we all are scared of it. This is one disease, I think, uh, kind of sends chill down the spine once you hear about it. Is still, why are not we able to either prevent as a society, as a healthcare system, or as individual, or detect it on time?
So that's a very pertinent question. And there are many answers, many reasons why we are not able to get our patients early enough to the clinics in stage 1 and 2. In the Western world, majority of the patients, they come to the clinics stage 1 and 2. And that is why their cure rates are so high. Our cases are majority in stage 3 and 4. And obviously the amount of treatment required becomes much more. The resources required are much more. And the curability drops drastically in stage 3 and stage 4. Why? Why we are not able to get them? I think we are lacking in spreading our message about the cancer disease burden, the cancer disease as such, number one. Now, I give you an example. 20, 25 years back, when HIV/AIDS was raging, there was a lot of discussion. And then everybody felt that Africa would be swept away, India will have huge number of patients of HIV/AIDS. What did the government do? Government went all out. They even trained to the last point, even the barbers, not to reuse the blades and the equipment they were using during the haircut and the shaving and all that. That was driven by the scare that this would sweep and this would overtake the nation, and we don't have the resources. That type of a frenzy and that type of an educational or a spreading the message has not happened with cancer. In the 70s, this was thought that cancer is a rare disease in the developing world, and this was majorly disease of the Western world, where 70% of the cancer cases, global burden was coming from the Western world, and only 30%. But mind you, by 2030, this will reverse. 70% of the patients will come from the developing world, from countries like India. India represents less than 10% of the world population today, but has 10% of the cancer burden today. So we are actually headed towards a huge number of patients. So first, as I said, is spreading the awareness about the disease, early warning signals. Then a massive anti-tobacco campaign has to happen. 40% of the cancer cases in India are directly linked to tobacco. Cancer of the mouth, voice box, lung, food pipe, stomach, pancreas, kidney, uterine cervix, the list is very long. So 40% linked to tobacco itself. The third is there are no screening programs. We don't, if someone wants to get screened for the common cancers, there are no public health programs. Insurance doesn't pay you. The government doesn't have those facilities. The government is grappling with the basic needs, health needs of the country. Cancer comes much later. So, long and short of it is spreading awareness. What is cancer? What are the early warning signals? When should someone go to a doctor? That's number one. Number two, tobacco. Number three, screening programs. I think
Very,
will bring
very,
it much earlier.
very important point, Dr. Vaid, you have highlighted. And as far as the awareness part is concerned, in the example of HIV, how the country dealt with that, and especially if we take up a very more recent example, maybe COVID-19 is also the one, that example where we sent
Exactly.
this kind of fear all across the society. And I think we might have made maximum behavioral changes in the recent history during COVID-19, in comparison to any other issue. But while COVID-19 might not be having that kind of mortality, uh, though the infections can be rampant, but the mortality that is not that high. Is still what we saw, that people gave priority to COVID-19 infection, even in cases like cancer. So people delayed their treatment.
True.
They delayed their, ongoing procedures. How do you see, that kind of a situation? Is it also because of the lack of awareness? I think those who are already into the process of getting treatment of cancer, they know what cancer is and how deadly it can be.
Right.
Still many of them, kind of pushed it, or their families pushed it, that they did not want to get the COVID-19, kind of exposure. So is it, completely a awareness issue, or there is something more to it?
So I think the one of the key differences is the acuteness of the problem. COVID came like a lightning from the blue, like a bolt from the sky, and everybody was actually driven by that fear factor. Cancer has a chronicity. Cancer, everybody feels that this is a distant disease. This is not going to happen to me. The acuteness of the problem probably was the one which led to a behavioral change in the COVID scenario. Let me go back to the first comment I made. Now, WHO has given an advisory that being overweight, obesity, is contributing to about 20% of the cancers. So there should be a massive campaign to limit tobacco, to encourage people to exercise, maintain their body weight, look after their diet, look after their health, the lifestyles. So, and simple things that if there is a message on most of the TV channels every day that exercise 20, 30 minutes a day, look after your diet, don't smoke, don't use tobacco. It will go a long, long way, I tell you. 10 lakh people succumb to this disease every year. 17 lakh new cases every year, out of which 10 lakh succumb to the disease. It's a huge number.
How, when it comes to, kind of quitting tobacco or regulating tobacco, one thing is that definitely, there is a need of higher awareness. But it is also largely, as you said, that everyone feels that cancer is not going to happen to me, at least to me. This is, I think, is one thing which everyone nurtured this thought. And that is why I think they are not able to make those, corrective measures in their behavior. How do you think that, what can be the way to actually make people quit tobacco? Should it happen from the government? Has it to come from the families? Can children make a difference? What as per you, has been the most effective, kind of trigger to make people quit smoking or reduce the tobacco consumption?
So let's look at the various measures the government is doing. The government is increasing the taxes every year. It's not bringing down the consumption of tobacco. Marginally, yes, over a period of time, but not drastically, not to the extent we want it to happen. The government has banned the sale of tobacco in certain areas. They're putting up pictorials. It's a paradox. The packet of tobacco has a picture that it causes cancer. Everybody still consumes it. And we are questioning the validity of the vaccine. So this is human behavior, So what can be done? It is a chapter on good health must start in the primary school. The catch them young, catch them at an impressionable age. That's the time when most of us would succumb to tobacco. It's the adolescents who are impressionable. Government has done very right. They have banned the ads on tobacco because someone sees a celebrity with a cigarette in hand gets converted. That's the right way to go about it. But catch them young. Children will have not only a behavioral change right in school, but they will also make their parents also behave the way. If you tell them that don't jump the red light, they will not allow their father or their mother who's on the wheel to jump the red light. And similar story would unfold in terms of the tobacco as well. Of course, the government needs to rehabilitate those farmers also, find an alternative crop for them. A lot of things, other things need to be done, the upstream and the downstream. lot of action needs to be done. You just can't tell the farmer, stop growing tobacco next year. What is he going to eat? How is he going to survive, So there has to be an action plan. And let me share with you, India is signatory to what is called as the International Framework Convention on Tobacco Control. All that convention says is set your deadline. If India says we would control tobacco by 2050, they say very well, do it. Take 20 years more, 30 years more, but do it, set a deadline. They're telling every country to set a deadline.
To set your own deadline.
Yes, yes. You say, no, we'll do it in 2080. Fair enough. Do it in 2080. But have a deadline.
Dr. Vaid, tobacco has been a kind of proclaimed offender as far as cancer, is concerned, or trigger for cancer or cause for cancer. Of late, or maybe in the last 5-6 years, we have been seeing a large number of cases, I believe, and you must be seeing them, where the non-smokers are getting, the kind of cancers which were normally attributed to smoking population, lung cancer, or the other relevant cancers. What is the primary cause you see behind it?
That's an amazing question, and we are confronted with this question every day in the clinic. Non-tobacco cancers have risen in incidence. For example, breast cancer, colon cancer, pancreatic cancer, lymphomas. These are all cancers linked to changes in the lifestyles, overall lifestyles. The consumption of the fat, refined foods, lack of exercise, and then we are moving away from nature. We have really moved away from nature. We are eating and drinking a lot of processed and refined foods. Also, the environmental pollution, let's not forget that. Insecticides, pesticides. The more you process the foods, you're taking the nature away from them. Sedentary lifestyles, no exercise, lack of breastfeeding, economic pressures. The marriages are late. Women are going to work. Breastfeeding has gone down. So it's a complexity of factors. And if you look at it, our lifestyles in India changed in the last 30-40 years, 40 to 50 years. Ever since the 70s and 80s, we have also been afflicted because of the globalization, about the changes in the food habits. We are moving away from our ethnic diets. It's a complexity of factors. Environmental pollution, lifestyles, sedentary, we are not exercising. Our foods have become more refined. Environmental pollution, all these factors are contributing to the rise in the incidence of cancer, non-tobacco related cancers, to be precise.
So the kind of complexity you are highlighting, Dr. Vaid, it seems there are innumerable of causes, and many of them are beyond our control. Definitely by overall systemic change, they can be, eliminated. But as long as, that kind of massive change is not done, it seems not to be, going away. Can in that scenario, one understanding that everyone should develop is like in COVID-19 that, most of the people, even those who have got COVID-19, still feel that they may get, despite that there is a very scientless, kind of reported number where you have had a secondary COVID-19 infection. Still people feel, and they are equally careful.
Right.
Should we, send across a message and people should start understanding that everyone can get cancer instead of thinking that I'm not going to get cancer?
Excellent observation. And these are the words. These are the words to catch what you said. Cancer is a disease which pervades through all the ages. It can develop even within the an unborn child in the mother's womb, from age 1 to 100, everybody is prone to cancer. The types of cancers are different in different age groups, but the human body is prone to cancer. No age group is immune. Though we know that as the population ages, now this was the point I was coming to next, and you have actually highlighted that point, that which are the age groups. Cancer partly is a disease of the aging process also. At independence, the average life expectancy of an Indian was 37 years. So if an average Indian was living up to 37 years, the probability of getting cancer was low. As you start living higher and higher, your probability goes up. Today, the life expectancy is touched 70 years. So that goes to say that a substantial population is going to live beyond 70 years. And that is a vulnerable age group. So partly the numbers are rising because we are living longer. And we are also, an aging population. Apart from the complexity of the issues around us.
So, sir, in that case, we have plenty of causes. Human body is prone to developing cancer. I heard, somebody saying that the only way to prevent cancer is not to be born.
Right.
Or not to have cancer is not to, get birth in this world. So maybe once you have this tissue-made body, these tissues are going to have some issues for sure.
Right.
As we kind of grow. So we had those plenty of causes. One that we are kind of trying to work a lot on is the growing pollution, the growing air pollution, the quality of air which is deteriorating almost every second day. And then the life expectancy has gone up, which has also made us vulnerable for that. In that scenario, if we start feeling that, okay, the cancer is something which anyone can get that disease. And so what beyond that? If prevention, let's say, is not always happening, what is there once I get cancer? Is it still a death sentence as we used to think, or we have moved much more beyond that?
So definitely science has moved ever since the human genome was mapped. So we now know that cancer is a disease which starts because of certain changes in the genes, some mutations in the genes. And our treatments of today have become more specific, more targeted, and that is making cancers get under control much better than what we were doing maybe 15, 20 years back. The average expectancy of life even in some of the stage 4 cancers has gotten better. Cure rates are getting better, and then science is moving on, and new therapies are emerging at a very, very fast rate. Let me share with you and the others who are on the program that almost about 50% of the research in medical science today is focused only on cancer.
50% of the research.
50% of the clinical research. Only for lung cancer, there are more than 1,000 clinical trials on today to find a cure to the disease. So similarly for breast cancer, for colon cancer, for other cancers, hundreds and hundreds of clinical trials are happening. You're hearing about COVID, that there are 5 vaccines, 10 vaccines, 20 vaccines, or 50 vaccines. Imagine for just one disease entity, lung cancer, more than 1,000 clinical trials are on. So science is trying to find the answers in a very systematic manner. And this has happened courtesy the understanding of the human genome and understanding of the human biology much better in the current century, post year 2000. That is helping the doctors treat the cancers more effectively, more efficiently, in a less toxic manner. The side effect profiles have gotten better. Of course, the other side of the coin is that the tumbler is not half empty or half full. I would look at it half full. It's still half empty, but that gap is getting bridged. And the maybe the next generation of oncologists will be in a much better position. वो ज़्यादा सक्षम होंगे हमारे से.
I think the tumbler is half full and is also under the tap. So it is filling. It is filling.
Thank you so much. I learned it today. It's under the tap.
So the kind of the volume which you are highlighting, that 50% of the medical research is going on cancer, and such a massive number of clinical trials going on. One variant of it, lung cancer. So like this is the age of vaccine. Everyone talks about vaccine. I think people would have used this word much more times than any time in their lifetime earlier. Do we have any vaccine for cancers also?
Yes. The simple answer is yes. There are vaccines which are customized to a patient's need, but only for very specific cancers. And these are vaccines created around, called as dendritic cell vaccines, where you take a biopsy, take some good cells out of the body, culture them in the lab, create a vaccine and put them back into the body. In fact, in India, the dendritic cell vaccine is approved for 4 cancers. There are many vaccines in development based on the peptides, based on neoantigens, based on the dendritic cells, combination of these vaccines with other biological products. So a lot is happening actually in cancer.
And there are tailor-made vaccines for that. Is there any general vaccine also? I think one cancer you would like to highlight, maybe, which has vaccine.
So that is the next I'm coming to. And after giving you some very disturbing facts, that India is the world capital of cervical cancer. About 100,000, about 1 lakh cases every year. Though the incidence has come down a little, it's a viral driven, like the COVID, happens because of a human papilloma virus. There is a vaccine to that for cervical cancer. Very effective. You need to give 2 or 3 doses to young girls, preferably before they get married, between the age of about 12 and 20 years. That is one vaccine, which is, and let's not forget, vaccines for hepatitis. You do it against the virus, but hepatitis C, B driven cancerogenesis in the liver is what you prevent. So these vaccines are helping prevent cancers, and hepatitis and the cervical cancer vaccine is a prime example. And this has now become part of many nations have taken up as part of the national vaccination drives in their own countries.
Unfortunately, India is not one of them as of now, but I'm sure very soon it will join that league.
It should be. But it's available. It's still available.
Dr. Vaid, at the very beginning of this discussion, you talked about screening.
Right.
Screening is definitely very important from both individual and from the healthcare system point of view, from the community health point of view. As you mentioned about cervical cancer, India having the high load, the number 1 cancer among women was cervical cancer, which is now, I think, taken over by breast cancer. But cervical cancer is still is one major cause of worry.
It is still, yes.
The recent National Health and Family Survey says that the screening for cervical cancer, which your in the basic survey screenings which are conducted, only maybe 1.5% women in rural India actually got done that or were kind of screened for that. What kind of screening you propose or suggest that the government should be carrying out maybe, for example, under ongoing health schemes, maybe Ayushman Bharat, maybe, for example, now we see that we can test at a very high scale after COVID-19. We are also going to see that we can vaccinate at a very high scale.
Right.
Polio has been one thing, where we have vaccinated like anything and eliminated the disease.
Yeah, it's
What
historic.
can be the probable way forward?
So I will begin with little bit of science and little bit of philosophy. And it should be look after the women in the society first. Women are healthy, your families will be healthy, everybody will be taken care of. Start with only two to three things. Get after tobacco. It will be prevention. I call it as prevention of cancer. And get after cervical cancer and breast cancer. These are the two things. You will be bringing down picking the cases much early. Target the women cancers first. And amongst men, because men are the highest consumers of tobacco products, target these three. And a pap smear and a mammogram. Not much to say about that. The world has already shown that. We don't need to reinvent the wheel. We don't need to get into a debate about that. It's like saying that let's build safer roads. What are the safety parameters? These are all written everywhere. We don't need to get into that. And let's not say that in India, for India, humans are humans. Cancer is cancer. It's similar everywhere in the world.
Very important. Thank you so much, Dr. Vaid, for highlighting this. I think, if we are able to at least make a tangible difference in these three areas.
Yes.
One which you said that the, kind of reducing or controlling the tobacco consumption. The second is, trying to eliminate the preventive cause of cervical cancer and breast cancer. Okay. And among cervical cancer, definitely we have a vaccine, we have a, effective screening, much more, I think, affordable. Pap smear is something which is much more affordable.
Now, coming back to the vaccine story. Now we are telling the world that we are one amongst the 5 proud nations on this continent, this earth. So we should seize this opportunity to kick off a cervical cancer vaccine, India specific, India made, and for India. I think this is the moment we should seize.
And definitely we will be saving a large number of lives with that.
And why I say that get off these 2 cancers, because rest of the cancers where screening works, they're not as common in India. Prostate cancer, colon cancer, they're not much high up on the list, So let's not get our resources into areas where the fruits are not so low hanging. 100,000 cervical cancer, 130,000 breast cancers. And almost about oral cavity, lung, everything combined, 3 lakh cases more. So you will be looking after 5 lakh plus 6 lakh cases.
50% of the cases can be reduced.
Rest all can happen over the years. Once we get smarter, we make our, processes absolutely ironed out, we can fan out then into other cancers.
Very important, Dr. Vaid. I think this is something, and this is a very, very critical stage we as a country are at. And definitely we should take these lessons and this, I think the capacity building or the capability which we have got to kind of expand it into other disease areas like, this controlling cancer is definitely one among them. Since we are talking about screening, and so, for general population, the people who will be watching this program, who should get screening, Dr. Vaid, and how frequently, just as a, somebody living in city like me or you or, my team members, how frequently we should look for a screening of cancer?
So there are 2 ways of looking at it. Number one, looking at the history profile of an individual. say if my family has had a higher number of, more than one family members have been involved, then obviously I'm one of the targets. So that is a high risk group. The other is an average risk group or the standard risk. Anybody walking off the street into the hospital and saying the doctor that screen me, and says that there isn't any family history of any cancer. However, regardless of the risk profiles, the high risk, of course, their screening tends to be a little more intensive, more focused. But for an average person living in this society, there are set guidelines. Say for women, screening for cervical cancer, for breast cancer, and for colorectal cancer. These are the three cancers which are amenable to screening. Now, for those who are attending the program, let me clear out a point that for screening to be successful, the disease load has to be significant enough. It has to be a public health problem. Number two, the tools available to screen that cancer should pick up the right cases, should not pick up the false negatives. So if you give a false positive diagnosis to someone, then there is an anxiety. There is a whole amount of the cascading effects. So our screening tools have to be efficient and should not lead to false negative and false positive on either side. So the efficiency of screening tools has to be good enough. So that goes to say that our pap smears or the DNA tests or whatever you do, which is the standard way of looking at it and which is the way the world does it. Mammography beyond the age of about 40 to 50 years, younger individuals where there is a high family history. Colon cancer, depending upon the family history. So not everyone, and that screening starts at about age 50. But for cervical cancer, the screening starts after the onset of sexual activity. And then in our society, because we are a different society, it generally pertains to the post-marriage or post-onset of sexual activity. So, and for men, again, colorectal cancer, prostate cancer, these are amenable to screening more efficiently. And now we are talking of even those who are smokers and those who are gutka chewers, even an inspection of the oral cavity or doing low dose CT scans of the chest to pick up these areas much quickly, much early. I think these are the cancers for which screening is efficient. So the long and short of it is that all cancers don't fall within the purview of a high cancer burden, and all cancers don't have an efficient screening tool. So we can't screen everyone. Human body has more than 100 cancers, 100 to 150 cancers, out of which a clinician like me deals with about 30 to 50 cancers on a day-to-day basis. And all of them, mind you, are not amenable to screening. They have to be in a substantial number, and you have to have a tool to pick them up early enough.
Thank you so much, Dr. Vaid. I think that is also important. And as you have highlighted that there are, the cancers both in females and male where they can do screening. There is a age group, history of your family history, your other, risk factors, all, can give you enough signals or indications that, you should go for a certain kind of screening. So that's very important. Since Dr. Vaid, you deal largely with liquid cancer, so to say, and concluding this show without talking a little bit on that will be kind of keeping it incomplete. So Dr. Vaid, some overview about what are these lymphomas, leukemias, and as I at the beginning mentioned that we will talk about a little bone marrow transplant also. You are one of the you made history by doing 25 cases in North India. So what are why do we need that, and how does it save life?
So The basic premise and the basic concept about a bone marrow transplant, or now we call it as a stem cell, because that is the cell which is used earlier, because we were sucking these cells out of the bone marrow directly, and so it's a historical terminology, and that is why this was called as a bone marrow transplant to begin with. But in today's time, we harvest these stem cells from the blood and no more from the bone marrow. So we don't do those punctures into the bone marrow anymore. So the basic premise is that when we treat leukemias and lymphomas in certain situations, and some of the patients where our conventional treatment is not able to completely ablate or completely destroy the tumor cells, there we need to give a high dose of chemotherapy. And just to inform the viewers here, that if the average chemotherapy I use is the intensity is 1, I have to raise the intensity of these drugs almost about 4 to 6 times. Now, if you increase the intensity of these drugs 4 to 6 times, the body just cannot sustain it. It's like what happened in the nuclear blasts. The radiation dose was so high that the bone marrow actually dries out, and the victims of a nuclear blast die because their bone marrow totally dries out and they are not able to produce any immune cells, and they die of bleeding and infections. So similarly, if I give that high dose of chemotherapy to an individual, I need to rescue that. And what is the rescue? Rescue is these stem cells. These stem cells work like seed. They go back, seed the bone marrow, produce new saplings, produce new cells, and rescue an individual. It's like a parachute we give to someone jumping off an aeroplane, and then their parachute lands the individual safely. So the transplant of these stem cells, be from the individual himself or herself, or from one of the siblings, and now not only the siblings, these stem cells are traveling across the world, from one continent to another, from one country to another. So we are finding these matched donors. Imagine somebody sitting in India has a matched donor sitting in Poland or in Brazil. Those stem cells are flying in from those countries into India. And then we are doing these stem cell transplants. So you give high dose of chemotherapy with the hope that whatever residual disease is left will be destroyed by that high dose, and put these stem cells back in the body. And nature has made the body like that these stems, they go into the blood and they find their way back into the bone marrow. They go and sit in the bone marrow. They find their way back very faithfully. So that's the complexity and of the human body. And a new marrow is formed.
Develop. Thank you so much, Dr. Vaid. There's so much to talk actually with a expert and veteran like you. As you mentioned, there are more than 120 type of cancers. We just tried to kind of touch upon multiple things, but what I think is the key message coming out of it is that cancer is definitely preventable. When we are more prone to cancer, it is preventable. Tobacco, something which has become a very, very I think widespread evil in our society, is one such cause which can be eliminated as well. And then there are so many other ways where being fit, eating healthy, trying to reduce the pollution around you. There are multiple ways with which we can definitely reduce the burden of cancer, or try to save prevent more people from the tentacles of this disease. We look forward to have more such discussion with you, Dr. Vaid, to kind of a deep dive into a specific area of cancer, so that we can help more people who may be kind of having that disease in their family, in their friends, and they would like to know about it more. Thank you so much, Dr. Vaid, for your time today. And for our viewers, here was Dr. A.K. Vaid from Medanta Medicity, Gurgaon, who was helping us understand that how we can fight against cancer, how we can make India free of cancer by ensuring that we have right prevention and right, timely detection, and also, effective cure and treatment for cancer if it happens to anyone. Uh, for our other viewers, you can send more questions to us. We would be coming back with our next show next week. We would try to answer them as much as possible from our experts, and we also look forward to have Dr. Vaid again on this show to answer more of your questions which we might have not been able to cover in this program. In between, also keep following our Facebook and other social media pages for more information related to your health and well-being. And don't forget to, follow us on Twitter, Facebook, YouTube. This program was supported by Silpa Medicare as part of their public, awareness initiative. We will be back with our next show next week. Before that, I would request Dr. Vaid to kind of give his parting remark of, what should be the takeaway message for our viewers when it comes to staying healthy and also protecting themselves from cancer.
Thank you, Kamalji. At the very outset, I should thank you and your team for this wonderful program and for having me on this show. And my key message would be that stay healthy, eat healthy, and shun tobacco. There is no safe tobacco on this earth, and don't succumb to any of those gimmicks. And एक अपना संतुलित वजन रखिए, exercise, control your weight, and then the जो जीवन की गाड़ी है वो सड़क के बीच में चलती है, वो neither left nor right. So adopt habits and your lifestyle should be like a middle of the road lifestyle and not on the extremes. I think that is all that is modifiable, that is within our means. You and me cannot control the pollution outside, but whatever is within our means, I think we should begin. Charity begins at home, and then we should control what is within our means, and then rest will happen over a period of time whenever it happens.
That's a wonderful message, Dr. Vaid, that by telling that the kind of जीवन की गाड़ी सड़क के बीच में चलती है. This is a message for all our viewers that the life has to be balanced. Anything and everything which you do, it has to be balanced. You have to have balanced diet, you have to have balanced exercise, and that's what Dr. has highlighted. Thank you so much, sir, for your time and your bringing in so much of information and putting it across for our viewers, which is so effective and easy to understand. Thank you so much. And also to our viewers, we will see you soon next week in our show on cancer care during COVID-19. Goodbye. Thank you so much.
Thank you. Thank you and your team. Thank you.